So if you're expecting, you know your calendar is probably filling up with ultrasound appointments. But there's one scan in particular, the detailed scan, that's a really big deal. It's a major milestone, but what exactly are doctors looking for? Well, let's dive right in and break down everything you need to know about this incredibly important checkup for your baby. Here's what we're going to cover. We'll look at all the scans during pregnancy, figure out what a detailed scan actually is, nail down the perfect time to get one, walk through the head-to-toe examination, and then finish up with some key things you'll definitely want to remember.
All right, first things first. To really get what the detailed scan is all about, we need to see where it fits into the whole pregnancy journey. Generally, you can think of your scans happening in 3 main phases.
So phase 1 is pretty straightforward. It's all about confirming the pregnancy and figuring out that very important due date. Then you have phase 3, way at the end, which is all about checking the baby's final growth and what position they're in for birth. But right there in the middle, that's phase 2. And that's our focus today, because that's when they do the routine growth checks and this super thorough detailed scan. Okay, so what is it that makes this scan so detailed? I mean, you see the baby in other scans, right? Well, this one has a very specific and much more comprehensive job to do. At its heart, the detailed scan is a screening. The best way to think about it is like your baby's very first full-body physical, just, before they're even born. The whole point is to systematically go through and check the development of literally everything, from the top of their head all the way down to their tiny little toes.
Now, as you can imagine, for an exam this specific, timing is absolutely everything. You need to hit that perfect window to get the best, clearest possible view of your baby.
And that sweet spot is almost always between 20 and 24 weeks of pregnancy. Now, you might see some places start a bit earlier, maybe around 18 weeks, but that 20 to 24 week period is widely seen as the ideal time, and there's a really good reason for that.
It's a fair question, right? Your first thought might be, well, wouldn't a bigger, more developed baby be way easier to get a good look at? It seems logical, but in the world of ultrasound, it's actually the complete opposite.
Yeah, that's a total myth. The reality is, for this scan to work, the baby needs enough space in the womb to actually move around. If you wait too long, the baby gets bigger and more cramped in there. That makes it really hard, sometimes impossible, for the sonographer to get the angles they need or to compare the left and right sides of the body. That 20 to 24-week window, it's the perfect balance. The baby's developed enough to see everything clearly, but still has plenty of room to wiggle around.
Okay, so what is the doctor actually looking at during this pretty long appointment? Let's get into the nitty-gritty of their checklist. And I want to stress again, this is a slow, methodical process. This isn't just a quick peek to see if the baby's waving. They are painstakingly examining one part of the body at a time, taking very specific measurements and looking for key developmental markers. The checkup literally starts at the head, looking at important parts of the brain. From there, they move down to the spine to check its alignment and make sure it's forming correctly. The heart gets a lot of attention. They need to confirm it has all 4 chambers. They'll also find the kidneys and the stomach, check all the bones in the arms and legs, and yes, they will even try to count all the fingers and toes. They wrap it all up by getting a good look at the face, ears, and eyes. It is incredibly thorough. All right, to finish up, let's cover a few practical things about this scan that are really important for all you expectant parents out there to know.
And this is a really key point, especially for anyone in Malaysia. The detailed scan is actually not a mandatory part of care in the public government sector, and the reason is purely practical. The patient volume is just so high that it's not feasible to perform a scan this long on every single person.
Because it's so complex, this scan has to be done by someone with very specific training, either a specialist, a sonographer, or a doctor who's been certified for it. And like we said, expect to be there for a while. A proper detailed scan is going to take anywhere from 45 minutes to well over an hour.
This is probably the most important takeaway. If anyone ever tells you they finished your detailed scan in 5, maybe 10 minutes, you can be absolutely sure that it was not the comprehensive exam we've been talking about. The time commitment is one of the best ways to know you're getting the real deal. So there you have it. The detailed scan is so much more than just another cute picture of your baby. It's a critical screening tool that gives you an incredible amount of information. And knowing its purpose, the timing, and what's involved really empowers you to be a part of your own prenatal care. So the real question is, what are you going to ask at your next appointment?